Dear friends, welcome to our channel. If you are experiencing joint pain or discomfort, this message is for you. Joint pain can be a challenging issue to deal with, particularly if your joints are swollen and red. One potential cause worth considering is gout. Contrary to popular belief, gout is more commonly found in men, although its occurrence in women has been on the rise. Unlike bunions, which gradually develop due to factors like improper footwear or flat feet, gout is a metabolic disorder caused by elevated levels of uric acid in the blood. While gout often affects the big toe joints, it can also cause inflammation in other joints, such as the knees, ankles, hands, and even the heel tendon. In some cases, this heel pain can be misinterpreted as a heel spur, adding to the confusion. Historically, gout was known as the disease of aristocrats, because it predominantly affected men who consumed excessive amounts of alcohol and meat. However, in recent times, the prevalence of gout in women has increased. This can be attributed to dietary changes, including higher meat consumption and the intake of processed foods like sausages and smoked meats. Additionally, the use of certain blood pressure medications has been observed to contribute to gout development. It is worth noting that a significant percentage, approximately 70%, of various blood pressure medications have been associated with the development of gout, as indicated in their drug labels. These labels often mention that the medication may cause gout or lead to an increase in uric acid levels, a condition known as hyperuricemia, which can subsequently trigger gout symptoms. Therefore, if you are taking medication that includes such warnings and experiencing unexplained joint pain, it is possible that the medication is contributing to your discomfort. However, we should not disregard the fact that improper diet and excessive alcohol consumption remain significant factors in the development of gout. It is crucial to be mindful of these lifestyle choices. And how can you differentiate gout from other joint diseases? Classic gout attacks are known to be incredibly acute. The affected joint becomes inflamed, red, and swollen. The pain is so intense that it can make a person feel as if they could climb walls. These severe attacks of joint pain typically last for about 3 to 4 days and then suddenly subside, leaving the person feeling healthy again. However, this is a typical presentation of gout in men. In women, gout can manifest differently, often triggered by medications. The attacks may still be severe, similar to those in men, but they can also be milder with constant, low-level joint aches. Women tend to experience gout more commonly in the knee joints, whereas men are less likely to have knee joint inflammation. Due to the atypical presentation in women, gout is sometimes misdiagnosed or mistaken for other conditions. To properly diagnose gout, it is crucial for all patients, especially those with knee joint involvement, to undergo both X-rays or CT scans and blood tests for uric acid levels. It's important to note that paradoxically, during an acute attack, the blood test for uric acid may show normal levels because the uric acid is leaving the inflamed joint at that time. Therefore, the uric acid blood test should be conducted during the interictal period between attacks. As for treating gout, the process involves 2 stages. The first stage focuses on relieving the acute attack and providing pain relief. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Voltaren, or meloxicam are commonly prescribed during this stage. Diclofenac, also known as Voltaren, is considered one of the most potent options. These anti-inflammatory drugs should be used for short courses, usually lasting 3 to 7 days, until the attack subsides. Additionally, they may be taken for an extra 1 to 2 days after the attack. The second stage of treatment focuses on managing the disease itself and preventing future attacks. If gout is determined to be caused by blood pressure medications that elevate uric acid levels, it may be necessary to switch to alternative medications that do not contribute to gout development. The second occurrence of gout, caused by an eating disorder, requires following a specific diet, preferably in reasonable quantities. However, it is important to note that the internet is filled with outdated diet recommendations, making it challenging to find accurate information. Doctors often prescribe a drug called allopurinol to manage gout, but unfortunately, it is frequently misused. For instance, allopurinol should never be taken during an ongoing gout attack as it can potentially intensify the symptoms. Many doctors commonly prescribe allopurinol for extended periods, such as a year or two, which I personally do not favor. Prolonged use of allopurinol can lead to increased blood sugar levels and potentially develop type 2 diabetes in patients. Hence, I recommend a course of allopurinol for 2 to 3 months, once or twice a year, with breaks in between to alleviate these risks. However, it is important to be aware that frequent and extended use of allopurinol can strain the kidneys and cause complications. To mitigate this, it is advisable to support kidney function before starting the allopurinol course by cleansing them with herbal medicine. When undergoing allopurinol treatment or managing gout in general, it is crucial to remember to drink at least 1 liter of clean water daily. This excludes coffee or juice. It should be pure water, ideally up to a maximum of 1.5 to 2 liters per day. Unlike other joint diseases, gouty inflamed joints should never be warmed, and physical therapy is generally unnecessary. In conclusion, it is essential to recognize that while allopurinol is effective in managing gout, it cannot cure the condition if it is caused by medication. Likewise, if gout is a result of excessive alcohol consumption, gradual alcohol reduction is necessary, along with a dietary adjustment that includes reducing meat intake. We hope you found today's information helpful. Thank you for joining us, and stay healthy.